Dr. Pilgrim with the Heartlife News Update. Here's a story of a guy who walks into his doctor's office. It's not a joke. He gets a complete physical. Doctor says, "You're fine. Everything, all your tests came back normal and you're perfectly healthy." He leaves the doctor's office and the next day he dies of a heart attack. This happens all too common. Let me just tell you a little story. This guy went to the doctor, he went to the cardiologist, they did all of his tests and everything was fine, except one of the cardiologists noticed that he had a little blip on his EKG. It just wasn't perfect. So upon further examination, they found that the only marker that he had elevated was lipoprotein A. This is a small molecule that is very dangerous and all people should be checked for it. In fact, if you have high lipoprotein A, you have a 10 times higher incidence of risk of a heart attack. So I'm not kidding, you need to get this test done. Well, what they did is after they noticed that, and they noticed the only thing was lipoprotein A was high in his test, they did do a scan on him and they found that he had 75% blockage in his artery, and they completely missed it. This is the typical case of a person who goes to the doctor, gets a clean bill of health, and he dies of a heart attack. That is a very extremely important test to get done. There are actually 3 tests that I recommend outside of the normal HDL, LDL, total cholesterol. Those tests are really good. However, the most important is lipoprotein A, C-reactive protein, and homocysteine. Those tests you must get ordered to reduce your risk. You don't want to have high lipoprotein A, have them miss it and drop dead of a heart attack. You know, if you go to my website, natureswindow.net, you'll find a free report there. You just put your email address and name in the top right, you click on it, it says 3 tests that'll save your life. And I go over each test, C-reactive protein, lipoprotein A, and homocysteine. Here's the kicker. All of these tests are reduced by nutrients and not drugs. That's why they're not promoted by the drug establishment and the drug companies. But I want you to be completely safe. I want you to be completely protected. Get those tests and get on the nutrients I recommend to lower those tests. Lower your risk of a heart attack. Don't become another statistic. Have a great day.